Hey, everybody, welcome back to the Energy MD podcast, where we help people with chronic fatigue, ME/CFS, and long COVID get their lives back so that they can enjoy what they've been given here in this life. So thanks so much for joining me here today. We're going to be talking about the triad, and I know you're super curious about what the triad is because I am as well. We're going to be doing that with Dr. Jamie Kunkle. And so let's learn a little bit about him. So he's been practicing as a dual licensed naturopathic doctor and East Asian medical practitioner acupuncturist for 10 years. He specializes in tick-borne illness, Lyme disease, long haul syndrome, autoimmunity, and chronic pain. He received a Bachelor's of Science in Neuroscience from the University of Pittsburgh and a Master's in Acupuncture and Traditional Chinese Medicine and a doctorate in Naturopathic Medicine from Bastyr University in Seattle. He currently works with the Gordon Medical Associates in San Rafael, California. He has 2 daughters that keep him very busy. He enjoys being in nature, working on his house, and spending time with his wife, whom also is a naturopathic doctor. And he is also an electronic musician when he finds the time. Dr. Kunkle, thanks so much for joining me today.
Pleasure. Happy to be here.
So I'm going to have to ask you about the electronic music at some point, but we're going to start off.
We'll get there.
We're going to start off jumping into the triad. So we're going to be talking about fatigue and the triad. Well, why don't you tell us, what is the triad?
Yeah, what is the triad? That's a really good question. I mean, this is a very complex, connected set of symptoms that a lot of my patients are now presenting with. And, it's something maybe I just wasn't as aware of before and more aware of now. I think COVID sort of maybe amplified some of this. It's really hard to say. But what I would say is the triad, plain and simply, is a combination of mast cell activation, dysautonomia, and hypermobility syndrome. So when those 3 come together, they're very interconnected. They kind of feed each other in not always the best ways. It makes how you approach those patients, those cases, a little more complicated. So the awareness of identifying the presence of the triad in an individual can really help streamline the process and what you need to do. And in the context of fatigue, all 3 of those things together are almost certainly feeding into the presentation, the symptom of fatigue that may be the most debilitating to that individual, whether they're diagnosed with chronic fatigue syndrome, ME, or post-COVID, or any number of other conditions. So you really got to dig for this, because a patient may come with a Lyme diagnosis, or they may come with like stuff that was pretty hard to find to begin with, yet the understanding of the triad isn't exactly there. So I have to kind of parcel that out and figure out how I can support these people, because it was probably it's an interplay of the genetics of the individual, what their susceptibilities are to this type of syndrome, the triad, and then the epigenetic influences that come at them. And there are many. And one of them may be infection, like COVID and this kind of thing. One of it could be toxin illnesses like mold or other environmental pieces. Any number of those things drive the process. So it's a coalescence then in that case between genetic and epigenetic or environmental influences on this person. So it really helps me to understand that, because if I go back in their history, even look at their family history, or, I can find some soft signs of this stuff developing at their early age. It just didn't become so dysfunctional. It didn't become so debilitating until later. So it can happen at a really young age, certainly, but it's a process. So it really helps me to better understand. So I'm going to talk more about that in just a little bit, but that's pretty much what the triad is: mast cell activation, dysautonomia, and there's a lot of different types of dysautonomia, and hypermobility syndrome.
Thank you. So can you define each of those terms?
Sure. I mean, I think mast cell activation gets thrown around a lot. I mean, maybe it should really be mast cell disorder, because I think there might be a little bit of a differentiation there. First of all, mast cell activation is a little hard to diagnose. We don't really have really great tests for that right now. There are tests, and I could certainly discuss them if interested, but they're not perfect. Far from perfect. Mast cell activation is generally a clinical diagnosis, but there's a lot of different aspects of the immune system that can activate or signal the mast cells. So just calling it mast cell activation across the board. It's kind of a simplification in some ways, but maybe it's more appropriate to call it a mast cell disorder. So this is a part of your immune system, what's called your innate immune system, kind of like your first line of defense to the outside world, to infection, to whatever is, triggering the immune system response. It produces histamine among many, many other inflammatory signals or cytokines. But we most often think of the mast cells as being histamine producing. Get stung by a bee, that big, giant, terrible red response you get initially. A lot of mast cell mediation there, as one can imagine. So they line our skin, they line our gut, they line our brain, they line our sinuses. They're all over the place, ready and waiting to jump when needed. So they're appropriate. They have an appropriate response too, but sometimes they can get a little overwhelming, as you can imagine. I mean, think about even just classically anaphylaxis or something, like having trouble breathing from an allergic reaction, or when the bee sting goes bad, for example. And those are really severe and really extreme ends of it. Chronic mast cell activation is kind of like a low-level activation. It doesn't exactly go back to its calm, quiescent state. It stays activated. Some believe it's a gene switch, So there's a lot to talk about there, but that's mast cell activation in a nutshell. Dysautonomia comes in many forms. It's basically an imbalance in your autonomic nervous system. Your nervous system is constantly adapting to the world around it. And that may be positional changes or stressors or infection or anything. And it lives in these two different states. Sympathetic nervous system, which is your fight or flight or freeze response, primarily driven by adrenaline. And then the parasympathetic nervous system, which is your rest and digest response, primarily driven by acetylcholine, which, don't need to know that. So where does dysautonomia, what's most common presentation there? Probably POTS, or postural orthostatic tachycardia syndrome. That's a mouthful. Basically, if you're standing up from seating, your heart rate goes up, you feel like you're going to pass out. Very common. People in post-COVID, for example, might notice more dysautonomia symptoms. It may be driving their fatigue. It may be driving these symptoms I just mentioned. They may feel really dizzy or lightheaded quite often, but it comes in many forms. It can happen in the gut too, for example, what we think of as SIBO or gastroparesis I can talk about, but motility or movement issues in the gut that can manifest in different ways is a dysautonomia too. Hypermobility syndrome, well, you might be asking the question, well, I'm really flexible, but I'm not sick. It's not always a problem to be really mobile. It's really not. But it's when you are inflamed or all these other things start to happen, or the mast cells or whatever, they're all interconnected, start to make the hypermobility less and less functional. You can be born with a really severe form of it and have a lot of dislocations, get injured very easily. It's like every time you get a trauma, you feel worse and worse and worse. And then it's much easier to get another trauma later, like a dislocation or another twisted ankle or something like that. But hypermobility isn't inherently a problem. You see many gymnasts out there who are doing pretty well for themselves and don't have POTS or something, and don't have allergies, and they're really healthy. It's usually whenever those environmental influences come again into the equation, further inflame the collagen in the soft tissue, further soften that system, and make it less stable. So that's pretty much hypermobility and why it's important in this context. So that's the one that gets missed the most. I know patients in their 50s, 60s who have never been diagnosed their entire life or recognized as being hypermobile. So that one's the one that we miss a lot.
So what's the connection between these?
Sure.
How do they relate?
Sure. Well, it's really quite interesting. There are many connections between them, I guess I should say, to start off with. But let's give a scenario, and I can give you an example of how they're connected. So mast cells, as I mentioned, can be activated by the environment, by toxins, by infectious triggers, for example. So there is an inflammatory response. The mast cells become activated. As those mast cells are activated, they start affecting the nerves in the nervous system. They can affect the autonomic nervous system. They can affect the vagus nerve, or the infection or the toxin can directly affect the autonomic nervous system. And that inflammation, as I just mentioned, can also directly affect the soft tissue or the collagen and worsen the hypermobility and the instability. And you add a trauma or something other big on top of that, and it's just a time bomb waiting to happen in terms of blowing up the syndrome and turning it into something not so functional. So that's kind of the simple answer to it, is it's all inflammation, really. It's the inflammatory response that connects every one of these points. The mast cell is clearly a inflammatory response, and the other parts of the system, like the autonomic and the connective tissue, are affected by that inflammation.
Yeah, for me, I'm always looking at, okay, like, what's the cause of something, right? What's the underlying cause? And what I've found is that heavy metals, chemicals, molds, infections, and trauma are kind of the cause of everything. And they end up triggering inflammation. And depending on the location of some of these, determines whether or not they have different symptoms. Is that kind of what you're saying here?
Yeah, in a sense, I'd say you have to think about the cause of this to treat it. But what's also very important to understand about the triad is that this is one example where palliative supportive care is of the utmost importance too. That we don't want to necessarily just tunnel vision on treating the cause all the time. If the person is terribly unstable, you can get to that.
Mhm.
But I think of it sort of as more of a phasic system, where this is a complex presentation where you have to sometimes actually band-aid it first in order for the person to heal. So that is just, and there are many other syndromes that I think can take that order, but this one I think is one way to differentiate it. So yes, you need to figure out the causes. A lot of times with these things, there are a lot of causes. I'd have to say it's the coalescence of things, but certainly if it happened and started after COVID or after a big trauma, you do want to hone in on that. But if they start trying to address those things and they feel significantly worse, the palliation needs to happen first. The things that bring the symptoms down need to happen first.
Absolutely, yeah. And so I call that, in my program, I call that step 2, which is kind of like replacing deficiencies in hormones and nutrients and stuff like
Mm-hmm.
that before we kind of start removing a lot of these toxins. How do you do that? How do you see that in terms of some of that palliation, or what I call a natural band-aid?
Yeah, no, absolutely. I think that the foundations are always incredibly important, and I certainly don't jump them. I think that's one of the first conversations that I have in terms of their nutrients, their diet, their support systems, their social health, their emotional health, their spiritual health. All these kind of things are of the utmost importance, especially for the autonomic system, naturally, in terms of the latter stuff like the emotions and the spirit and stuff like this, because those will help to keep the people more in parasympathetic tone. And then most of these folks, which we'll get to some of the reasons why people are fatigued here, but most of these folks do not have quality nutrition for a variety of reasons. Either there's malabsorption or overutilization, or it's very common when you have all this together to be very low on very vital nutrients, especially fat soluble vitamins, for example, maybe vitamin D, for example, but iron is also up there. So you have to really fine tooth comb the nutrient systems and really understand where they're at a loss, because even just simply repleting those things can be very important. And their diet is absolutely affecting the mast cell system. Most of the time, they're reacting to the foods that they're eating, and it's worsening their inflammation and their fatigue and everything in the worst kind of way. So you really have to overhaul sometimes their diet, not always permanently, but temporarily, at the very least, until this stuff calms down. And so, and with that in mind, you're also optimizing their nutrient intake. You're making sure that you're supporting their collagen systems in regards to their hypermobility, because they need collagen, and just straight processed collagen might not always be good for their mast cells. So they need it in food form. And it's hard. I mean, I'm not against anybody that's philosophically or ethically against meat, because there's a lot of bad stuff that's going on in the meat industry. Understandably, but if you can find ethically sourced meat and be okay with using it therapeutically, it's a great source of collagen. And if it's fresh as can be, fresh, only frozen once, it's not going to activate the mast cells as much. So you see how you can easily connect all these things together when you're formulating a plan. And so, yes, the foundations, as mentioned, are absolutely integral here.
Mm-hmm. Interesting. Um, and so you're a TBD guy. You understand tick-borne diseases, and so I struggle with collagen because I know that Bartonella likes to feed on collagen.
Yes.
And so the question is, if you think somebody's got Bartonella, do you give them collagen?
It's a good question, honestly, and it comes up quite a bit. I'm not, I guess I should say I'm not terribly dogmatic on this for a variety of reasons, because these people are so nutrient deplete that sometimes they're very nutrient depleted. Some of my patients are, let's just say that, the ones that come to me. Not all of them are. So for me, I need them to have core basic nutrition. I really do. And it's like the absence of that collagen is causing more harm to them than possibly feeding the bug a little bit. And so there are times and places where I might deprive that system a little bit more if the patient is more robust. But most of the time when people are presenting to me with the triad here, they are not stable enough for me to deprive vital nutrients and vital aspects for them. So that's kind of the way I personally see it. And I haven't really honestly had been able to connect clinically that that's causing a big harm to them. I think sometimes mast cell reactions are misconstrued as Herx reactions too, or Herxheimer reactions are basically increased infection activity or die off or whatever. People tend to call it all Herxes, but that's not really always what it is.
Right. And what do you recommend for as an MCAS diet? Are you low histamine? Are you paleo? What do you like?
Yeah, low histamine, I think, is a general rule, because there's foods that contain a lot of histamines and there's foods that tend to uh, increase the production of histamines. And so starting there is really a good place to begin. And it's interesting because a lot of those foods are otherwise very healthy for us. You know, some of them are really. So you have to kind of reframe what's good and what's not at the time, I have to say. But it still comes down to the reality of it. It's just like any other dietary interventions, whether you're doing elimination rechallenge, any food sensitivities or whatever, you have to kind of challenge this stuff and see what the person is actually reacting to. Because the thing about mast cell activation is they could literally be reacting to anything. They could be reacting to the med or substance that is treating their mast cell activation. Go figure.
Right.
So you start with the low histamine and you kind of work your way through there. Some people have definitely been going into the paleo, and some people have even been going as far as the carnivore and still being somewhat successful here, especially if they have really bad SIBO or small intestine bacterial overgrowth, or some other gut issues that where they're not as easily able to eat vegetables or like FODMAPs or fruits and stuff like this, things that cause fermentation in their system.
And does identifying this triad help you clinically, or how does it help you clinically?
Oh
Does it tell
yeah,
you
good.
severity or?
Yeah, it does often tell me a little bit more about severity, how much I need to maybe do for this person, maybe prognosis to some degree too, how long it may take to kind of unwind their situation. And it really does depend on where they come in the process. If they've been to 20 other doctors before me and they've all sort of missed the mark on understanding some of these things, okay, it might be a little bit harder because it might have been 5 or 10 years and there might have been progressions of some of these illnesses. For example, there's a progression of hypermobility called CCI, craniocervical instability. And basically, if that starts to happen, it can be incredibly disruptive. So what was once a infection illness now becomes a structural issue that needs to be dealt with appropriately. So it really just depends on where they come in the process. So yes, it does help me. I think it just puts things into a little bit better perspective about where I need to put my energy and how I maybe need to adjust their lifestyle their lifestyle in different ways. Like if they're exercising really intensely, even when they're fatigued, and that might be a problem in and of itself. But if they're hypermobile, I might need to back off or change the way in which they exercise or change the way in which they eat if they have mast cell activation. And it's really just helpful to understand their day-to-day better, what's important to them. And the more they're educated and empowered with this, the more it's supportive of getting them better quicker. So yes, it's important for prognosis and just how aggressive I may need to be with the treatment and how much I may need to do or not do with somebody.
Mm-hmm. And I've seen resolution of MCAS and dysautonomia by removing toxins, replacing deficiencies, stuff like that. But I haven't seen a change in hypermobility. Is that because and I haven't worked with a lot of people who have it, but is that because that's more genetic than some of these other ones? Or tell me a little
It's
bit more, I guess, about hypermobility and
yeah,
Ehlers-Danlos may be the
yeah,
difference.
Ehlers-Danlos. So Ehlers-Danlos is just one form of hypermobility syndrome. It's been maybe mapped out a little bit more, but it's not actually the most common form of hypermobility. So if you do genetic testing on somebody and expect to get an EDS diagnosis, you're more often than not going to come up dry there, because the genes that basically are related to hypermobility syndrome itself, HSD versus HSD or whatever, ED, yeah, and all those acronyms. Basically, just hypermobility itself, it hasn't really been fully mapped out in the genome. So the presumption though here, just like mast cell, is that there is often some sort of genetic predisposition. People believe that you can also acquire mast cell activation. I think it is reasonable to say that in certain circumstances, you can probably acquire hypermobility too through different means. Chronic inflammation softens collagen, as mentioned. Repetitive traumas, physical traumas, especially to the head and neck, can cause instability. So you can have regional instability that we call sort of a hypermobile whatever cervical spine or something like that. It's not a full body hypermobility syndrome, because the hypermobility syndrome that we think of generally is diagnosed typically by the EDS standards, the Baton score, how many joints move too much, bend too much in the body. And if you score a certain amount, depending on your age, because the older people get with hypermobility, the stiffer they get, and it's actually harder to diagnose them based on just the Baton score alone. It becomes a little bit more complicated. So that's the reason why these things can get missed too. But I'd say that hypermobility doesn't exactly go away once it's developed, but physical therapy, and physical therapists can really tell you this. I think they've probably done some of the best work with hypermobility of anybody in medicine. I've met some amazing physical therapists. There are ways to rehabilitate people and to get their system stronger. And I think with regenerative medicine, there may actually be a way to unsoften that collagen further. But really, to get the inflammation down is going to be the primary objective all the time with these people. But really, the muscles, the tendons are always a modifiable factor in hypermobility. You can always get to the people to a point where they can rehabilitate, they can do PT, and you can restore a certain level of function in those people. So yeah.
Thank you. And so how does the triad play in with chronic fatigue?
In many, many ways, actually. I could start with just really simply put, with hypermobility, for example, the muscles and the tendons and everything have to work really hard to compensate for laxity in the ligaments. And that actually uses up a lot more energy just to walk around. You'll see a lot of people with hypermobility that just, they can't stand on their feet for a long period of time. And it's like their body, their mitochondria have to work twice as hard to do some simpler things. And so that can easily be misconstrued as like a classic chronic fatigue thing, but it may just be that they have to work a lot harder as far as that goes. The mast cell activation, the inflammation response can certainly directly affect the brain, the nervous system. There are a lot of mitochondrial disorders that are associated with these folks. There are a lot of sleep disturbances. Sleep studies are very important with people with a lot of apnea with hypermobility, a lot of apnea with anything in the triad, theoretically. The dysautonomia causes disturbed sleep too. People wake up more frequently, whether they recognize it or not. If they're in chronic pain, they don't sleep well. I mean, a lot of sleep is a very hard, difficult thing to address in the triad, but it's absolutely integral too, if I didn't mention that already. Hormone dysregulation is very common, and that can certainly contribute to fatigue. Women, unfortunately, tend to have it a little bit worse with the triad because of estrogen and progesterone, which I can elaborate on further. But estrogen dominance can activate mast cells. Progesterone contributes to ligament laxity, and then pregnancy has relaxin and all kinds of fun stuff. People with the triad tend to produce more insulin. They tend to get more hypoglycemic easier. They can develop a whole array of endocrine disorders. If it's really severe, there can be changes in intracranial pressure, high pressure or low pressure. Those things can really make people terribly fatigued. I mean, if you had a CSF leak, cerebral spinal fluid leak, you would want to be upright at all. pretty much. Autoimmunity is very common in this population, as you can imagine. That drives fatigue. Nutritional disturbances, I already mentioned, drive fatigue. And of course, they tend to get anemic very easily, which is a really, simple thing to look at for people, is to look at their iron and ferritin and, try to get them to a place where they feel comfortable whether their hemoglobin is in range technically or not, because these people are very sensitive to shifts in their iron. Once again, women tend to get the short end of the straw for that as well. So those are just some general explanations, and there's probably a lot more too that we didn't mention, or that we don't know about even, but that's pretty much the big ones that I know of.
And what would you say is the biggest needle mover when it comes to the triad? Is it changing the lifestyle habits? Is it boosting the deficiencies? Is it removing some of these toxins? What have you seen?
Well, I think it does take a holistic approach, I'd have to say. You need to do all of it if it's really severe. I mean, that goes without saying. You need to do all of it. What's most effective? I think the awareness of it, like, is the first step to really like diagnose it and to empower people with the knowledge of what it means to them. I think is a really big deal, because for a long time, most of these people get gaslighted into oblivion by conventional medicine. They're just told that, no, you're not in that much pain, or no, it can possibly be as sick as you say you are. You're just depressed, or you're just anxious. Like, well, I am depressed and anxious, but I also have this really complex medical condition that nobody's diagnosing. So I think the recognition of it and the diagnosis of it and the empowerment that comes with that is actually one of the most powerful things you can do first off, which is why I'm talking about it today. And then after that, you have to dive in, and the toxins are of the utmost importance. A lot of people do believe that one of the main reasons why this is becoming more recognized and more of an issue and less functional for people, even with their genetics, the genetics haven't necessarily changed entirely. It's the epigenetic influences, it's the toxins. A lot of the toxins we're exposed to on a regular basis are less than 100 years old. They're newer. Our humans have not had an opportunity to adapt to toxins in the environment. I mean, you can even ask the question of why we're having more problems with mold than we did if we've been around mold for thousands of years too. So so I would blame toxins probably above all for one of the reasons that this is becoming more of an issue. And so if you can identify that and figure that out, that's probably the second biggest game changer and needle mover. Because if you go guns a-blazing into the infections and you don't know about this other stuff, you can make these patients incredibly ill, incredibly sick. And that's been definitely something that I've seen too. So I'm careful. I'm very careful. Yes, I work with Lyme and tick-borne infection, but I've learned, we've all learned over the years, we have to really take a more holistic approach to this. We can't just go straight after them, because that's creating more toxicity for them, and that's creating more dysregulation in their immune system, and it's doesn't always go the way that you hope it is.
So would you say, when I talk about toxins, I'm talking about like heavy metals, chemicals, molds, infections? I kind of group all them in there.
Yeah, sure.
Which toxins would you say, or which one of those would you say is kind of the biggest needle mover?
Yeah, I mean, I guess I would say, oddly enough, despite my recent statement, I still think mold seems to be one of the bigger ones. Mycotoxins just, they really, mess up the autonomic system. A certain number of people get worsened mast cell issues with that. And the effect of those toxins on the chronic inflammatory cycle really does seem to worsen the instability. So I think we also maybe have, I don't know, I guess maybe we have better testing sometimes. I don't think the testing is perfect for mycotoxins, but I think it's as hard as it is to identify mold, we actually seem to have the resources to do that in some cases. I think there are probably a lot of other toxins we haven't fully understood, like some of the work of Dr. Andrew Maxwell talking about toxic algae blooms and stuff. He's researched that in the East Bay, for example, like cyanobacteria and stuff. There's got to be other toxins in the environment. Of course there is. But I think once you identify the mold, I think it also is important to note that the detox regimen you put people on with mold probably helps with other toxins too. And I certainly don't want to downplay heavy metals, whether the patient's young or old. Heavy metals can be found in this population, and they're very high. They're very high typically. So I usually will get them out of mold or remove them from any clear environmental influences first. And the metals I will get to oftentimes, and I will have already sort of done some work on them by probably detoxing them, with whatever I think is more important, like the mold first, and then the metals kind of come later. But metals will definitely affect the collagen, affect the joints, of course, affect the gut, affect everything, even mast cell. I've seen with metals too. You can see the whole shebang with heavy metals too.
And do you find that you have to address the molds and the heavy metals before the infections?
That's the way I'm operating these days. The only time I jump ship is if the person is more acute, like if they had an acute tick bite, if they have like an acute massive autoimmune type presentation of an infection, I will sometimes have to rescue that situation with either antibiotics or other, natural antimicrobials for a short period of time. It's because they're so sick and not functional. It's like I'm trying to bring them off the edge. So those are the times when I really, jump ship a little bit. But generally speaking, I think I appreciate my colleague I work with, Dr. Parpia. She really is very strict about detox first and give it time. And that's actually a really important principle and a really good reminder. And I definitely did not have as much patience as that in my earlier career. And I'm learning to come around and and be a little more patient, even if I know the infections are underlying in there. But there's a time and a place. I am not rigid on that. Acute tick bites, acute manifestations that are really destructive, they sometimes have to be treated.
Yeah, we're having conversations right now, in our business and in our practice and with our clients around the expectations, and all of our programs are 12 months because that's kind of generally the minimum amount that it takes to go through this process, because slow and steady wins the race. What have you seen in terms of what do you think are realistic expectations for people who have the triad, who have a number of these toxins, and you're trying to get rid of them out of the body?
Add at least a year to that. I would say 2 years minimum is realistic. But that doesn't mean there's not a lot of progress we can make in a shorter amount of time. I think, with the advent of these fancy new medicines like peptides and other things, regenerative supports and stuff, sometimes we can improve them a little bit quicker. But I'd say realistically, really, if you're presenting with, some of the worst manifestations of the triad, it's going to be probably more than a year, realistically speaking. So the better you can frame that in the beginning, I think, that doesn't, once again, it does not mean you're not going to improve, that you're not going to feel better through the process. And it's so encouraging when you start taking that step in the right direction, when you start seeing that momentum. But you definitely have to have some patience in this game. Chronic illness is not, the acute stuff that we usually think it would be. If I get a flu, I might be better in a couple weeks or maybe a month. Worst case scenario, this is kind of a year or years sometimes. Yeah.
Yeah, and oftentimes that's kind of daunting for folks, and they're like, "Oh, but I've been sick for a decade," and the reality is that, when they invest that time, that energy, that money, the time goes by quite quickly, and then you have your life
Does.
back,
It really does, actually. It
I
can go by
remember
quick. It's hard, but
I remember
yeah.
when I went through residency, and it was kind of like, gosh, I really don't want to go through residency. I could probably come out. I already knew I wanted to be practicing more holistically. And it's like, well, I'm going to put this time in, and it's going to allow me to do things that I couldn't do before, and it's same sort of idea. There is a return on your investment. It's kind of like getting a master's degree. Like you go in a couple of years, you do the work, and then you come out and you can do things that you couldn't do before.
Yeah, no, absolutely. Sometimes there are things that were a little more functional for them, but still affecting their daily life that also improve. So sometimes you do come out, a little better all around because once again, earlier on, before the illness got too bad, there were these soft signs that there was a tendency toward dysfunction or dysregulation. So you start addressing those deeper things in people too. And it's pretty amazing. So it is a bit of an investment time, certainly financial. Unfortunately, our conventional system isn't as supportive of this process in terms of chronic illness and holistic care. I really wish it was. Believe me, I think that's something I hope to see in my lifetime. Is that change? It's just going to take. It's a whole other conversation for another time.
Yeah, and really an important one. That's something that I struggle with is, the cost of a lot of the therapies,
Yeah.
a lot of the supplements that we're using. And so, what do you feel like? I know now we've got peptides. I don't know if you're doing IV therapy.
Oh yeah.
I know you're doing like hyperbarics and stuff like that too. What do you feel like is the biggest bang for the buck, generally?
Yeah, I mean that's a good question. I guess I want to say that with my previous statement of this does take some time and patience and sort of directed energy toward it in terms of lifestyle shifts and basic stuff. There's a lot you can do with a little with this too. There's not a guarantee that you need all the high end stuff. The high end stuff I think is very important for one, either enhancing the treatment and hopefully expediting it and really supporting it on a higher level in terms of maybe moving things forward. But and the other side of it is the people that often come to our clinic are very, very, very sick and not functional. So the higher intervention stuff is for a certain group of people, the people that are either privileged to have the resources to kind of, really step it up quicker. And then the people that really nothing else is moving the needle, we have to try to use these bigger interventions with them. But the majority of people, if they present with more on the functional end of the triad here, there's a lot of stuff they can do orally, at home, not as always as expensive in terms of supplementation. And even, for example, with dysautonomia, let's just say, getting somebody some compression socks can be quite helpful. Help getting the blood flow up to the core, up to the head, up to the brain, kind of artificially creating a pumping motion for them. It can be a big deal whenever you're on your feet walking around. You won't feel like you need to be horizontal quite as much. Really simple. You can find those on Amazon. Salt intake, increasing salt intake and hydration. We used to always be told that salt was bad for us and is going to cause problems. That's not entirely true. I do have patients that are salt sensitive, but the majority that have the triad need a lot of it, more than you'd think you would need. So that's really basic stuff for dysautonomia. If you're kind of hard pressed too with the mast cell activation, there are a lot of over-the-counter antihistamines. I don't love them because they have a lot of additives and excipients that don't always do well, but there are ways you can, yes, it is a drug model, but unfortunately drugs are sometimes cheaper. So I meet people where they are sometimes with that process, but I can do antihistamines. I can do, really basic prescriptions sometimes to kind of navigate the mast cell activation and kind of palliate those symptoms even. And then the hypermobility is a little more challenging in some ways, but some of the stuff that affects the mast cell is going to reduce the inflammation in the soft collagen too. And even just getting more dietary curcumin or turmeric might be really helpful for some of those people, and just removing the inflammation from their diet, getting those foods out that are triggering them really terribly. So some of the foundational stuff here that is really actually quite important and can be really profound is actually pretty inexpensive too. It's just, it depends on where the person is in the process and how severe and how not functional they may be. And as mentioned, our clinic really ends up seeing most of the ones that have kind of seen other doctors and been through that process, and they need higher interventions of medicine, to be clear.
Mm-hmm. And what are your favorite peptides these days to treat the triad and some of these underlying causes?
Oh, for sure. Well, for hypermobility, we use BPC 157 because that can help with collagen and reduce inflammation. It does a lot of stuff too: gut barrier, blood-brain barrier, liver support, immune modulation, viral support, all kinds of cool stuff. It's really quite far-reaching. And then we use copper peptide, GHK-Cu. Copper peptide is a really good one. It's a blue peptide. It's kind of fun. That one's good for soft collagen too, and trying to help increase stability. Can reduce inflammation. Sometimes it helps energy too. BPC also can help energy and fatigue, which is really nice. And then we'll use thymosin beta-4 frag from the oral sprays that are available out there. That's a good one because it doesn't activate the mast cells, for example. So it's a good one for general immune modulation and healing. Also for more pain or connective tissue support, I think is how I use that. And then I'll branch into the mast cell ones like KPV, also good for large intestine support. Has some good overlaps with some of the mold rehabilitation stuff too, I believe, with the MSH. Won't get into that too much. And then the Amlexinox I've been using more. It's an oral that helps modulate histamine and leukotrienes. That one's been studied with atopic derm, has a really good safety profile. It's an oral peptide. I've liked that one quite a bit. And yeah, and I do more than that too. It just depends, but that's my core, I'd have to say. And I don't necessarily do those all at once, although sometimes I might layer them in slowly one at a time, and I'll rotate them, or I'll load them in the beginning until people are more stable, and then I'll pulse them kind of thereafter. So it really just depends. But most of these people do better with the injections typically. But if I'm really trying to treat the gut directly, I think the orals are just fine.
Very nice. And so the Mlexinox, you said that was for atopic dermatitis. Is that like an autoimmune modulator?
Yeah, I mean, technically it probably is hitting most of the mast cell signals, as I mentioned.
Okay.
But yeah, it's been studied a little bit with autoimmunity as well. It had some other, yeah, it doesn't have a ton of papers on it, but I haven't had really, like, the safety on it has been really good, I'd have to say. You can get it from, I think, one pharmacy, TaylorMade, I believe, is the only one you can get it from that I know of.
Mm-hmm. Excellent. And do you like it better than KPV, or how do you use them differently?
Really depends. I'd have to say that what happens in a lot of these cases is I really have to challenge these things in like micro doses to these people half the time. So I might have them get a capsule and take a small bit of it out, or even do 1 unit of an injection or something crazy. Once I can establish tolerance, that's always my first step with any of these peptides. Then I can kind of move them through. So some people do better with one versus the other. Lately, I've been preferencing Amlexinox over KPV. Sometimes I've had more reactions with KPV, but it's not guaranteed. There may be some biomodulation with KPV that's happening too in the gut. I don't know, it has a little bit of a mild antimicrobial effect is what I've read. So there could be a little bit of disruption there. A lot of these people are really sensitive to just a little bit of movement in the microbiome too.
So with MCAS, a lot of people are really sensitive who have
Yes.
MCAS by definition. And so consequently, they may have a hard time tolerating supplements. We like to go topically with tinctures, obviously removing foods and stuff like that. But, oftentimes the more sensitive they are, the more toxins they have, the more sensitive they are. And so it's really, you don't really make a dent until you start removing the toxins. What what have you seen as like the biggest needle mover for some of these folks with MCAS to get them to tolerate treatment?
Yeah, it's a good question. I mean, unfortunately, some of it is still trial and error. There's not some sort of like perfect algorithm that works for it. But for example, some of my patients with MCAS, I realized, just are reactive to almost everything from the natural world for some reason, like all the herbs, because it's closer to the foods is one suggestion. And I
Mm-hmm.
can actually give them drugs and they do really well with it. So,
Mm-hmm.
not nothing is off the table with these people when you start. Some of my patients literally can't take anything by mouth, but yet I can give them stuff in IVs all day long. And so I can kind of like give them very slow titrations of IV medicine, for example, until they're more stable. So the route is really important. If a lot of the MCAS is in the gut, you have to be really careful how much stuff you throw in the gut. And then what type of substance that you're using. As I mentioned, don't necessarily throw out all your drugs if the person is reacting to all your natural stuff, and vice versa. Don't neglect the natural world if all the drugs are making you feel absolutely terrible. So those are some ways in which I've navigated it, but it's a slow and steady process, and it is trial and error. It's being very transparent with people that even with the best of intentions, this drug may have a body of research, or this substance may have 10, 20 papers that say it's going to help you, but it's still you. It's a personal situation. It's a personal response. And so we have to really be communicating regularly and really try to move this forward. So step one can be the most challenging when people are really far on the dysfunctional end of that spectrum.
Well, Dr. Jamie, this has been excellent. Any last things you want to share with folks that we haven't talked about?
I mean, no, I think I would just say that generally there may have been a little bit of an uptick in these syndromes since COVID. So even though we're further away from COVID-1 in 2020 or 2019, actually, just recognize that it is still out there and it can still influence these conditions. And that doesn't mean like live in a cave under a rock or anything that you have to be like really fearful of it, but just recognize that some people get these responses heighten immensely when they're exposed to COVID. Some people still don't do well with that particular virus, and probably the spike protein. A lot of different theories on what's happening there. So just be mindful of what's around us. Flu and other infections and stuff like that too. But yeah, I just wanted to put a little plug in for awareness around COVID, because right now it's kind of all around us in high amounts. So if you get that and your symptoms are worsening immensely, hopefully seek somebody that's in COVID too, which is kind of becoming its own sort of thing. Though it's been modeled off of a lot of what we've understood in the past about post-viral syndromes, it really has its own little perks. So I just wanted to put a little awareness plug in there.
Thank you. And do you have a favorite COVID prevention strategy?
Well, all the foundations as mentioned, sleep and healthy diet, and stress management, all that kind of stuff. But yeah, generally the nutrient factors are really integral, making sure that people have enough vitamin D, have enough vitamin C, zinc, just kind of some very basic stuff, honestly, that they have enough resources to be able to manage it effectively, and that they're not basically overstressing or overstraining themselves through working too much or putting themselves in places that are going to be harmful or problematic. And then also keeping their blood sugars, insulin, all the cardiovascular and heart disease kind of stuff in check as well. So really just healthy lifestyle and core nutrients are a good way to offset to some degree. And then early treatment. Yeah, early treatment is my opinion on what to do with it. Treat it early. If that means Paxlovid for you, that's fine. If it means nutrients and other things, do what is right for you and your care team.
Excellent. And where can people go to learn more about you, to connect if they want to work with you?
Oh, sure. Well, you can visit us at, I believe, gordonmedical.com, or you can just search Gordon Medical Associates on the web, and you can search my name. You might find me on some YouTube videos too. I'm doing more of these things, so you could probably find me. But definitely go to Gordon Medical. You can talk to Rachel, as our new patient coordinator. She'll talk you through all the details. So give us a call.
Excellent. Yeah, we'll drop the link below.
Thank you.
If you've listened to this or you've watched it and you like it, please give us a thumbs up or 5 stars. We really appreciate it. Dr. Kunkle, thanks so much for joining me today. This was excellent.
Thank you. Have a good day.
I hope you learned something on today's podcast. If you did, please share it with your friends and family and leave us a 5-star review on iTunes. It's really helpful for getting this information out to more people who desperately need it. Sharing all the experts I know and love and the powerful tips I have is one of my absolute favorite things to do. Thanks for being part of my community. Just a reminder, this podcast is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional. It is provided with the understanding that it does not constitute medical or other professional advice or services. Thanks for listening, and have an amazing day.